Mental health matters. A look at Nepal. Nepal, a land of majestic mountains and vibrant cultures, faces a silent crisis: mental health. Despite the breathtaking landscapes and rich traditions, many Nepalese people are quietly battling mental health issues. The World Health Organization estimates that nearly 1 in 5 people in Nepal experience mental health issues each year. This staggering statistic highlights the urgent need for awareness and intervention. This means that millions of our brothers and sisters, mothers and fathers, friends and neighbors are silently struggling. They face their battles in isolation, often without the support they desperately need. Their pain is real, their needs are urgent, and their voices deserve to be heard. We must listen to their stories and understand their struggles. Mental health is not just the absence of illness. It encompasses emotional, psychological, and social well-being. It affects how we think, feel, and act. It is about well-being, about our ability to cope with life's challenges, to work productively, and to contribute to our communities. A healthy mind is essential for a fulfilling life. When our mental health suffers, every aspect of our lives is affected. Relationships, work, and even physical health can deteriorate. It is time to break the silence. We must start conversations, raise awareness, and remove the stigma surrounding mental health. It is time to recognize that mental health is just as important as physical health. Both are crucial for overall well-being. It is time to create a Nepal where everyone can seek help without shame and receive the care they deserve. Together, we can build a supportive and understanding community. Whispers in the mountains. The stigma of mental illness. In Nepal, talking about feelings can be difficult. Many people still believe that mental illness is a sign of weakness, a curse, or even a punishment from the gods. This stigma, deeply rooted in cultural and societal beliefs, prevents individuals from seeking help. Families, often out of love and concern, may try to hide the issue. They might worry about shame, social isolation, or even their children's marriage prospects. This silence only perpetuates the stigma and prevents those suffering from receiving timely and appropriate care. The fear of being labeled, judged, or ostracized keeps many individuals in the shadows. They suffer in silence, their pain invisible to the world. Barriers to healing. Challenges in Nepal's mental health care. Nepal faces significant challenges in providing adequate mental health services. The country has a limited number of trained mental health professionals, particularly in rural areas. This shortage makes access to care incredibly difficult for many, particularly those living in remote villages. The mountainous terrain, coupled with a lack of infrastructure and resources, further complicates the situation. Traveling long distances for treatment is often impossible, especially for those with limited financial means. The lack of awareness about mental health extends beyond the general population. Even within the healthcare system, there is a critical need for more education and training on mental health issues. Rays of Hope. Current efforts for a brighter tomorrow. Despite the challenges, there are glimmers of hope on the horizon. In the heart of Nepal, communities are coming together, driven by a shared vision of a healthier and brighter future. The government of Nepal, recognizing the urgency of the situation, has taken steps to improve mental health services. This initiative is a testament to their dedication to the well-being of their citizens. The Ministry of Health and Population has developed a national mental health policy, demonstrating a commitment to addressing this critical issue. This policy aims to provide accessible and affordable mental health care to all. Non-governmental organizations, NGOs, are also playing a vital role. They are the backbone of community-level interventions, ensuring that even the most remote areas receive the support they need. They are working tirelessly to bridge the treatment gap, providing counseling services, raising awareness, and advocating for policy changes. Their grassroots efforts are making a tangible difference in people's lives. The World Health Organization, WHO, and other international organizations are providing technical and financial support to strengthen Nepal's mental health system. Their expertise and resources are invaluable. These collaborations are essential for building a more resilient and responsive mental health infrastructure. Together, these efforts are paving the way for a future where mental health is prioritized and accessible to all. Section 5. Bridging the Gap: Technology's Role in Mental Health Care. In a country where geographical barriers often hinder access to care, technology is emerging as a powerful tool. Tele-mental health services, using video conferencing and mobile applications, are connecting people in remote areas with mental health professionals in cities. These digital platforms offer a lifeline to those who would otherwise have no access to care. They provide a safe and confidential space for individuals to seek help, receive counseling, and learn coping mechanisms. While technology cannot replace the need for face-to-face interactions, it offers a valuable bridge to care, especially in remote and underserved areas. Section 6. Community Matters: Local Solutions for Local Challenges. Addressing the mental health crisis in Nepal requires a multifaceted approach that goes beyond simply building hospitals and training doctors. It requires a shift in our mindset, a change in our attitudes, and a commitment to creating communities of support. Community-based mental health programs, often run by local NGOs, are proving to be particularly effective. These programs integrate mental health services into existing healthcare systems, making them more accessible and culturally relevant. By training community health workers to identify and refer individuals in need, these programs are extending the reach of mental health services to even the most remote corners of the country. Section 7. Breaking the Silence: Encouraging Open Conversations. One of the most powerful tools we have in the fight against stigma is our voice. We need to start talking about mental health openly and honestly. We need to create spaces where people feel safe to share their stories, their struggles, and their triumphs. Parents need to have open conversations with their children about mental health, teaching them that it's okay to not be okay, and that seeking help is a sign of strength, not weakness. Religious leaders, holding positions of influence and trust, can play a vital role in dispelling myths and misconceptions surrounding mental illness. Their voices can reach deep into communities, promoting understanding and compassion. Section 8. A Helping Hand: How We Can All Make a Difference. Each one of us has a role to play in creating a more mentally healthy Nepal. We can start by educating ourselves about mental health issues and challenging the stigma within our own families and communities. Small acts of kindness can make a world of difference. Offering a listening ear, a shoulder to cry on, or simply a word of encouragement can be a lifeline for someone struggling in silence. We can support local organizations working in the field of mental health by volunteering our time, donating resources, or simply spreading awareness about their work. Section 9. Towards a Healthier Nepal: A Future of Hope and Understanding. The journey towards a mentally healthier Nepal is a long and challenging one. It requires the collective effort of individuals, communities, and the government. Each step we take, no matter how small, brings us closer to a society where mental health is prioritized and nurtured. But it is a journey we must take together. Unity and collaboration are essential in overcoming the obstacles that lie ahead. By working hand in hand, we can build a supportive environment for everyone. By breaking the silence, challenging the stigma, and strengthening our support systems, we can create a future where everyone has the opportunity to live a fulfilling and meaningful life. Education and awareness are key components in this transformation. Let us remember the words of the Buddha, born in the very land we call home. Health is the greatest gift, contentment the greatest wealth, faithfulness the best relationship. These timeless teachings remind us of the importance of mental well-being. Let us strive to create a Nepal where mental health is valued, supported, and accessible to all. This vision can only be achieved through persistent efforts and unwavering dedication. A Nepal where every mind matters and every voice is heard. Together we can make this dream a reality, ensuring a brighter and healthier future for generations to come.